Before we start, I want you to do something for me. Take a quick look down at your ankles. Now, clear your throat. Weird request, right? But believe it or not, both of those little actions may reveal something important about your blood pressure medications. Because two of the most common blood pressure pills, that is Amlodipine and Losartan, may seem similar, but one could quietly puff up your ankles, while the other might give you a nagging cough that never quite goes away. So today, let us put them head to head, Amlodipine versus Losartan, and find out which one might be worse for you and which one might actually help you feel better. So before we go any further, this video is for educational purposes only. It is not a medical advice and should not replace guidance from your doctor. So always talk to your healthcare provider before making any changes to your medications. Hi, I am Nicholas. I'm a pharmacy practitioner interested in advising patients who are managing high blood pressure to do it effectively and safely. Every single day, millions of people, maybe even you, take medicines to keep their blood pressure under control. And two of the most common options out there are Amlodipine and Losartan. They both work, no doubt, but their side effects can feel very different, and understanding those differences can help you make smarter and safer decisions about your health. So let us break it down clearly and simply. Amlodipine is one of the most widely prescribed blood pressure medications in the world. It belongs to a family of drugs called calcium channel blockers. That name sounds complicated, but here is the simple picture. Calcium helps the muscles in your arteries tighten and squeeze. When Amlodipine blocks calcium from getting into those muscle cells, your arteries relax, blood flows more freely, and your heart doesn't have to work as hard. Doctors also use Amlodipine for chest pain, known as angina, to keep your heart arteries open, which helps oxygen reach your heart muscles and reduces pain during activity. According to the American College of Cardiology and the American Heart Association, Amlodipine is often a first-line option, especially for adults over 55 years, and it has been shown to work particularly well in African Americans and older patients. In studies, Amlodipine lowered the top blood pressure number, the systolic pressure, by about 16 points on average. For comparison, Losartan lowers it by about 14 points. Just a 2-point difference may not sound like much, but across millions of patients, that can translate to thousands fewer strokes and heart attacks, which is pretty impressive. But now, let us talk about how it feels to take Amlodipine, because that's where things get interesting. The side effects of Amlodipine. The most common one is swelling in the feet and ankles, or what doctors call bilateral edema. It happens because Amlodipine relaxes the arteries that carry blood away from your heart, but doesn't relax the veins that brings blood back to the heart. That imbalance lets fluid pool in your lower legs, and over time, it leaks into nearby tissue, making your ankles puff up or swell. The Cleveland Clinic reports that around 1 in 10 people taking 10 milligrams of Amlodipine experience this swelling, especially women, and especially those on higher doses or on long-term use. Other side effects of Amlodipine include dizziness, especially when standing up quickly, fatigue or tiredness, and mild nausea or stomach discomfort. While these are not usually dangerous, they can definitely affect your quality of life. If swelling or fatigue becomes annoying, doctors may lower your dose, add mild diuretic, or switch you to a different drug altogether. So overall, Amlodipine is powerful and dependable, but it carries high risk of ankle swelling, dizziness, and tiredness, particularly at higher doses. Now let us talk about Losartan. Losartan belongs to a class called angiotensin receptor blockers, or ARBs, ARBS. It works in a totally different way than Amlodipine. Instead of relaxing arteries directly, Losartan blocks a hormone called angiotensin 2. This hormone usually tightens your blood vessels and tells your body to hold on to salt and water. So when Losartan blocks it, Losartan helps your vessels stay relaxed, your kidneys flush out excess fluid, and your blood pressure drops naturally. Doctors often prescribe Losartan not just for hypertension but also for patients with diabetes or chronic kidney disease, because it helps protect the kidneys and reduce long-term damage. It is also used in certain cases of heart failure to ease the workload of the heart. In studies, Losartan lowered systolic blood pressure by about 14 points, just slightly less than amlodipine, but still excellent at preventing heart attacks and strokes. Let's look at the side effects of Losartan. The good news is that Losartan is much less likely to cause ankle swelling. That's why it is often preferred for people who already have leg edema. But there is a catch, okay? Losartan can cause a persistent dry cough in some people. This happens because the angiotensin pathway it blocks also affects certain enzymes in your lungs. When those enzymes are disrupted, it can create a tinkle in your throat that leads to a tough cough that just won't quit. For some, it is mild, but for others, it is so irritating and it can disturb sleep or conversations. When that happens, the only real fix is usually switching medications. There is also a rare but serious reaction called angioedema, that is sudden swelling of the lips, tongue, or throat. It's uncommon but potentially dangerous. If that ever happens, stop taking the medication and seek emergency help immediately. Other side effects of Losartan include lightheadedness or dizziness, mild fatigue, and occasional nausea or stomach upset. But overall, Losartan is very well tolerated. It protects the kidneys, lowers the risk of stroke, and doesn't mess up with blood sugar or cholesterol levels. So, which one is worse? Well, that depends on you. Amlodipine is slightly stronger at lowering blood pressure, but it is more likely to cause swelling, dizziness, and fatigue. On the other hand, Losartan is gentler on your legs and great for kidney protection, but may trigger nagging cough or, in rare cases, angioedema. If swelling is already an issue, Losartan may be better. If your kidney protection is a top priority, Losartan again wins. If rapid, strong control of blood pressure or angina is needed, amlodipine takes the lead. Sometimes, doctors even combine both drugs to get the best of both worlds while minimizing side effects. But remember, your best choice depends on your individual health profile, okay? So always discuss these options with your doctor or pharmacist before making any change. Here is what I want you to remember. Number 1, both amlodipine and Losartan are life-saving medications. Number 2, both lower blood pressure effectively, but their side effects differ. Number 3, never stop your medication suddenly. It can raise your risk of heart attack or stroke. Number 4, always tell your doctor if you notice swelling, dizziness, fatigue, or cough. Number 5, take medicine at the same time every day for the best results. Number 6, remember, healthy habits matter just as much. Less salt, more movement, no smoking, and steady weight control. So, tell me in the comments below, which one do you think you'd tolerate better? Swollen ankles or nagging cough? Your experiences may help someone else understand what real patients go through. If you found this breakdown helpful, please give this video a thumbs up. It really helps this channel to grow. And don't forget to subscribe to the Blood Pressure Pharmacist for clear, trustworthy explanation about medications you take every day. Stay informed, stay healthy, and I'll see you in the next video. Bye.